Hey everybody, welcome to this month's Question of the Month. I'm David Keil. I answer one of your questions every month in this format, which is nice and relaxed, a little bit more theoretical, but hey, that's how I'm doing it. If you've got a question that you want me to answer, go to yoganatomy.com/my-question, type it in, please give details, and I'll do my best to answer your question. This first question comes from Nooj, and she has a question about knee pain in Bhujapidasana. That she's had for many years. I've been practicing Ashtanga since 2010 on and off, but there was of course a certain period of time, 1 to 2 years, that I was totally dedicated to the practice. Even with such dedication, I was never able to do Bhujapidasana fully. She's okay with that. She can go as far as the stage of balancing with crossed legs, lifting. However, for the past 5 years, I've had a sharp knee pain on the right knee almost every time that I start to lower down to the floor, and when taking the legs out to take and go back to the Bakasana position. Would I be able to share how I should do to prevent the knee pose? So it's an interesting question, not a common place to get knee pain, but of course it does happen. So you also didn't specify where exactly the knee pain was. Is it kind of through the center line? Is it on the inside? Is it on the outside? So because I don't have the answer to that question, what I'm going to suggest is we do a little bit of testing. Like, you're going to have to try it a couple of different ways and see what happens. So the first thing I would look at is which leg is on top. In other words, which one is being pressed in by the other. Okay, that's important because the one that's in further is probably going to just get a little bit extra force when you cross the legs, and especially when you start to do the dipping forward part, because you're pulling in to try to keep your legs up. So, one, try switching which leg you put on top. Does it make a change? Yes or no? Yes, you have your answer. No. Okay, let's try to move on to the next step. The other technique or other test that you could do is, Bhujapidasana, a lot of people, they end up squeezing their knees, if this is my knee, squeezing their knees in up against their arm. But actually, what I would do is use your calf muscle and your hamstrings. I know that's my biceps and my forearm, but you know what I'm doing. As you grab your arm, squeeze with both legs, not just the leg that's on top. Make sure you're squeezing with both legs, and instead of squeezing the knees in, try to take the legs out. The way I say it in class is almost like you're doing a Baddha Konasana, where the feet are squeezing in and the knees are out. So not exactly, but more in that direction than in that direction with the legs. See if that makes a difference. And the other thing you could do, if neither of those two works, is try to figure out at which stage, when you're bringing your legs in, you start to feel the sensation. Like, where is that point where it starts? And sometimes it doesn't start right away and it builds up and then you have the sensation. And the other thing you can do with how you're already crossing your legs is, instead of squeezing in, try pushing your feet outward. Whichever one is underneath, push it back out against the one that is holding it. Instead of pulling in, match the resistance. So one leg is trying to straighten slightly, while the other one is trying to pull it in slightly, and see if that rebalances the tissues. And if none of those are the issue, and particularly if the pain is clearly on the inside or the outside of your knee, it might be due to lack of hip rotation, which is a very common cause, particularly in lotus. I don't typically see it show up in Bhujapidasana, but it's a possibility that you have to hold on to. So we also have to look at other postures where your legs are in similar positions, and whether or not there's some little bit of sensation there that might give us some information about this one. All right, so not a specific answer. You have to go do some testing. Try to figure it out. All right? Use the practice to explore stuff like this. All right, everyone. I hope that helped, Nooj. Anyone else, if you have a question, like I said in the beginning, go to yoganatomy.com/my-question.